monofocal and progressive IOL, which looks like monofocal but works like real multifocal. Its progressiveness is very similar to varifocal spectacle lenses. It's an oval or ovoid shaped IOL which is 6.3 mm vertical by 7.5 mm horizontal, progressiveness of which is achieved by gradient refractive index technology. There is a stepless or jump-free power distribution in the main optic of this IOL. And as we can see, at any size of pupil, ratio of light energy distribution remains the same. These two dialing holes are also positioned in solid and absolute rotational stability, and the large optic covers full visual field without leaving any aphakic zone, and hence this IOL is totally free from negative dysphotopsia. Autofocus Pro, although being a progressive multifocal, has MTF value of 0.65 for distance, 0.4 for near, at 3 mm pupil size, at 50 lines per minute, and thus IQ, the image quality at retina and Autofocus Pro is available as both versions, hydrophilic, non-preloaded with disposable injector and cartridge, which are in the box, and also as hydrophobic preloaded with push or screw dual mechanism injector. This silky, smooth and soft IOL's injection is very easy, as good as any other soft foldable IOL. And as you can notice, unfolding is gentle and slow, and once both haptics are in the bag, we have to rotate the IOL so as to keep both dialing holes in upper half of eye, keeping the IOL horizontal as best as possible. At any size of pupil, the light distribution proportion remains the same, and hence it is pupil independent. There is no light energy loss because there is no destructive interference or diffraction, and angle kappa or angle alpha are of least significance or importance. This is the only ringless progressive IOL having all zones in central 0.9 mm area, and hence it is independent of any pupil size. This is the typical post-op fogging over refraction chart, and as we can see that from +2 to -4, the vision remains almost the same, which is almost like 6 diopters of amplitude of pseudo accommodation. This is the typical DOF chart of Autofocus Pro, which is almost flat from +2 to -4, which is nearly identical to a teenager's natural lens DOF. With crisp and clear vision at all distances without any negative or positive dysphotopsia, Autofocus Pro is also a presbyopia correcting IOL. All near vision intensive vocations become spectacle free and as easy and as clear as a teenager. There is no need for mono, micro mono or mix and match vision. Autofocus Pro is also the best choice for kids. These children will need only monofocal spectacles to correct the gradually increasing myopia. They will never need bifocal or progressive spectacles, which is a big recurring expense for parents for over 2 decades. And there is no waxy or hazy vision, so no induction of mild amblyopia. We can implant this lens in one eye or in both eyes because it is so well accepted, just like a monofocal, without any neuroadaptation time, and it can be considered as a super EDOF or EDOF Ultra or EDOF Plus IOL. Phaco or MSICS Autofocus Pro is the best choice IOL. To conclude, all other IOLs are gems, but Autofocus Pro is the jewel of the crown. Thank you very much for your kind attention and patient listening.
Thank you. That was a good presentation, Arvind. I just have one question. How do you think, which category would you put in the sense that we have advanced monofocal, then we have trifocal, multifocal? What would you call it? Is it a kind of a...
It is a polyfocal progressive IOL without any refractive or diffractive ring and no posterior apodization. It's a polyfocal progressive IOL.
Polyfocal progressive IOL.
Yeah. Thank you.
You did mention that it can be very useful for pediatric this
Yes.
thing. So do they adapt easily? Like we've always been very concerned about using multifocals in pediatric.
They adapt it very
eyes.
well, sir. We are implanting in 10 plus year of age group, and they are accepting
Okay,
it
so
really
the cutoff
well.
is 10 years?
Yeah,
And
no
is it always-
neuroadaptation is required.
And can it be used unilaterally or it's always used bilaterally?
Both the options
Can
are
be used even unilateral if one eye is absolutely
yes,
normal?
yes,
Okay,
it can be.
perfect. Thank you.
Thank you.